Hi everyone, hope you're doing well and happy, beautiful Friday. It's finally kind of cooling down, uh, which fall is nice, but I'm not a winter lover, so definitely gonna really enjoy these days to come and short fall that we get to experience together. Today on Whitman-Walker's Instagram Live, we're gonna be talking about kisses, intimacy, and oral health. I think they all go hand in hand, whether it's oral sex or kisses or oral hygiene and flossing and keeping your teeth clean. So we're just going to talk through all of that and how they intertwine in ways that you can take care of your mouth and prevent STIs, because you can get STIs in your mouth and throat. Hey Coffee Press, hope you're doing well. Thanks for joining. Just going to get Whitman-Walker in the room. But in the interim, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs and sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and today we're going to be discussing kisses, intimacy, and oral health. And we just got Whitman-Walker here, so we'll get them on stage with us and then jump right in. But yeah, so today's topic will also give some tips on when it might be time to go to the dentist and when it might be time to go and get an STI test or your HIV test. If you're a sexually active person, it's super important that you do those kinds of screenings regularly. So yeah. Before we dive into it, this Sunday, September 18th, is actually National HIV/AIDS and Aging Awareness Day. This day helps bring attention to the issues related to HIV among older Americans, including new infections among older adults and adults over the age of 50 who are still living with HIV. All right, we're accepting the request of Whitman-Walker, but nothing's happening yet. It's one of those hard tech days with Instagram Live, it seems. We'll try to get them in here again. Okay, I think that one worked. Nice. All right, so again, Sunday is September 18th, and it's National HIV/AIDS and Aging Awareness Day. And so, again, this is a day that we just uplift people who are living with HIV and who are older than 50 years old, or people who are experiencing new infections of HIV at the age of 50. But kind of, what a privilege it is to have people alive today who are able to age with HIV. This infectious disease was a death sentence for so many people, but with science, folks who were preparing to die were able to start making plans for their life and were able to prepare to live. So definitely take some time to learn about this community this weekend and consider getting tested for HIV and STIs, and share your testing resources with a friend just so that they also know where they can access HIV and STI testing. But of course, Walker Health has testing available. You can call 202-797-4439 to schedule your HIV or STI testing appointment. So on to today's topic. We're talking about kissing, intimacy, and oral health. But I think first we've got to go through a few vagina or front hole anatomy fun facts just to get us grounded in the learning that we're going to do today. So let's go over some of the anatomy and front hole vaginal facts. So the vagina, front hole, or vaginal canal solely refers to the vaginal hole where babies can be delivered from and where insert of sex happens. The rest of the area is known as the vulva, which includes the inner and outer labia, which are also known as the vaginal lips, or the labia minora and majora, the clitoris, the clitoral hood, the mons pubis, which is where the hair, or the pubic hair, or pubes are, and the urethra, where the urine or pee comes from. So facts about the vagina and front hole are that it's self-lubricating. So with that in mind, lube still goes a long way for a more pleasurable sexual experience for all partners involved, and can also help prevent rips and tears and cuts from happening during sex. This is super important because rips and cuts and tears make it easier to get an STI during sex, but especially unprotected sex or condomless sex. So explore your water-based and silicone-based lube options. And another side fun fact is that silicone-based lube stays wetter for longer than water-based lube. Another fact about the vagina and front hole is that it's self-cleaning. So as it cleans itself, it'll produce a white or clear discharge. And during menstruation or being on your period, hormonal changes can affect the amount of discharge that is produced. On to some kissing health and facts. So according to healthline.com, kissing triggers your brain to release a cocktail of chemicals that ignite pleasure or ignite the pleasure centers of the brain. So these chemicals include oxytocin, dopamine, and serotonin, which can make you feel euphoric and encourage feelings of affection and bonding. It also lowers your cortisol, which is stress, the stress hormone. It lowers your cortisol levels and reduces stress and anxiety feelings. So it's a pretty healthy activity. Kissing actually increases your heart rate in a way that dilates your blood vessels, according to a book by Andrea Demergian. It's called Kissing, Everything You Ever Wanted to Know About One of Life's Sweetest Pleasures. And so when your blood vessels dilate, your blood flow increases and causes an immediate decrease in your blood pressure. So this means that kissing is actually really good for the heart. And with all this blood flow and dilated vessels, you can also help relieve your period cramps. So that's also pretty amazing. Kissing can also help boost your immune system and lower your allergic response and help you measure how attracted you are to someone. So, swapping germs with someone is good for building up your system, and again, can be kind of an identifier of whether you'd like the kissing to go beyond kissing with this person. So, EmbraceSexualWellness.com shares the following as it relates to oral sex, kisses, and intimacy. Blowjobs, fellatio, giving head, eating out, cunnilingus, and rimming are all terms used to reference oral sex in which any activity that involves the mouth, lips, or tongue to stimulate the genitals or anus of a sex partner is involved. According to the CDC, more than 85% of sexually active adults ages 18 to 44 reported having oral sex at least once with a partner, showing just how common it is. So if you had a room of 100 people, only 15 of them have not had oral sex with one of their partners. Or with a partner. The safest situation, other than abstaining from oral sex, and other than just not being a sexually active person, is to only have oral sex. So if you're in a sexually monogamous relationship, or you're only seeing one person and you and your partner have both been tested recently, that's kind of your safest scenario to engage in oral sex in. But not everyone's in the situation, and that should not deter you from having oral sex. It's just kind of the ideal situation where you wouldn't have to worry about STIs as much. So now let's talk about oral hygiene, because if you're going to be using your mouth for kissing or other activities or oral sex, we also want to talk about keeping your mouth clean and protected. So oral hygiene is a necessary part of life, and having a safer oral sex life as well. According to the CDC, poor oral health can lead to tooth decay, gum disease, bleeding gums, and oral cancer. And that makes it easier for STIs to be transmitted. So you want to make sure that you are brushing and flossing regularly. And according to the CDC, you can follow these tips to practice good oral hygiene. So you can drink fluoridated water and brush with fluoride toothpaste. You can visit your dentist at least once a year, even if you have no natural teeth or have dentures. And you can brush your teeth thoroughly twice a day and floss daily between teeth to remove dental plaque. It's actually even better if you floss and brush your teeth after every meal or every time you eat something. So one, it'll help you kind of pay attention to how much you're taking into your body, but two, it'll help you have really awesome oral health. So gross and fun fact, every day soft gunk and what will become plaque builds up on your teeth. So when you floss daily or after your meals, you help to remove this gunk. But when you don't, it's no longer soft, it's going to harden up and it's going to become plaque. And this is the kind of reason that you might go to the dentist to have it removed during your cleanings. But if you have a lot of plaque buildup, they're going to have to really get in there with that sharp water spitting needle tool that they use. And you're likely going to bleed a lot while they remove that plaque from your teeth. But if you floss really regularly and fight this plaque buildup, they likely won't have to do so much work on your teeth or have to go so hard with the needle tool. And you'll spend a lot less time getting your gum in your teeth razored at during your appointment than you might have before. So flossing is just amazing. That said, it's not a good idea to brush or floss your teeth directly before you're engaging in oral sexual activities or kissing. You want to make sure that you give yourself at least 30 minutes before or after brushing your teeth and engaging in sexual activity. So in the same way that having tears in the anus and the vagina or the front hole and having barrier-free or condomless or unprotected sex can lead to STI transmissions, cuts in your mouth can also lead to STI transmission. So again, if you want to clean up before a date or before you meet up with someone, just make sure you have given yourself at least 30 minutes after brushing your teeth or after flossing before you engage in any oral activity. And now on to STIs, since you now know that you can get them from oral sex. STIs are infections that are transmitted through sexual contact, and they can affect the vagina or front hole, the anus, and the mouth or throat, causing symptoms like discharge from vaginas and front holes and genital warts or sores for other areas that have experienced barrier-free or condomless sexual contact. So look before you lick. I'll repeat that again. Always look before you lick. Before you go down on a person or perform oral sex, you want to check for lesions, growths, or unusual discharge from the genital area. And if you notice any of these, you want to hold off on oral sex until your partner gets tested, since the symptoms could be due to an STI. Some STIs don't cause any symptoms and are only found during regular and routine STI testing. So that said, please call Whitman-Walker Health at 202-797-4439 and schedule an HIV or STI testing appointment in their Northwest or Southeast DC locations. And if you're not located in DC or their locations are just not easy for you to commute to, you can search for your nearest community health clinic, a Planned Parenthood, or your local health department to access HIV and STI testing. So here are some of the STIs that you can get through oral sex. They include chlamydia, syphilis, genital herpes, gonorrhea, and HPV. And HPV can lead to throat cancer if gone unchecked. So again, practice good oral hygiene, become a flosser if you're not already one. I know that for me, when I have or in the past when I've had dating profiles, I always included you are a flosser as one of my requirements for folks who I was considering dating. But just love oral hygiene. It's so amazing. And again, I think a lot of people just don't know that you can get an STI in your mouth and in your throat. So maybe if you were experiencing symptoms in your anus or just your front hole or your vagina, and you went and you got treated and they didn't swab your throat, even though you might have had oral sex or sexual exchanges using your throat. And so you'll get treated for one area and maybe not treated for every area that you need to be treated for. So just be mindful of that and keep up with your regular STI testing. But thank you all for learning a little bit more about kissing and intimacy and oral health. And before we go, we want to give you some reminders about COVID-19 and vaccines. If you've already gotten vaccinated, that's really awesome, as you're helping to keep yourself, your loved ones, and your community safe from illness. Multiple variants have soared across the world, and it's totally understandable if you might want to keep wearing your mask, as the vaccine is effective at helping you not get sick from COVID and helping you not die of COVID and helping you not end up hospitalized with COVID, but it does not prevent you from getting COVID. That said, please stay alert. And if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has vaccine available. Just call them at 202-207-2480 to schedule an appointment. If you're a DC resident and you're having trouble making an appointment with Whitman-Walker, you can always go to vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. And if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's really important that you consider getting the vaccine and discuss COVID precautionary measures with people who are around you and be mindful of masks and keep your distance, but especially when you do not know whether a person has been vaccinated or not. Because we're in two public health crises at the same time, I also wanted to share some monkeypox information. So according to the CDC, there are more than 22,000 cases of monkeypox documented in the US. If you're in DC, you can pre-register for a monkeypox appointment at dchealth.dc.gov/page/monkeypox. Virginia is working with local care providers to contact, trace, and identify those who are most in need of the monkeypox vaccine. And varying counties in Maryland are allowing residents to pre-register for a monkeypox vaccination, and the Maryland Health Department also just released a pre-registration system. So please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. And DC has had walk-up vaccine locations available every Friday at noon while supplies last, but going up until 8 p.m. since August 5th. These locations include 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, 7530 Georgia Avenue Northwest in Ward 4, and 1900 I Street in Northwest in Ward 2. Again, these are provided first come, first serve, so they're available to people who have not received their first vaccine. And yes, that's it. First come, first served while supplies last up until 8 p.m. You're currently eligible to be vaccinated in DC if you are a District of Columbia resident who is 18 years of age or older and also identify as any person of any sexual orientation or gender who's had multiple sexual partners in the past 2 weeks, including those currently considered highest risk, which include gay, bisexual, and other men who have sex with men, transgender men and transgender women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs. So think bathhouses, saunas, and sex clubs. Proof of residency is required for vaccination. So things that you can show include identification cards with a DC address, a utility bill, or other piece of mail with your name and a DC address, or a current DC lease or mortgage with your name on it. Thank you all for learning about monkeypox and COVID prevention, and remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check their website at www.whitman-walker.org for the most up-to-date information on their services. And for more COVID-19 resources and general Walker services, Whitman-Walker services, you can call 202-797-4439 and follow their programs and the Whitman-Walker family at RealTalkDC _ and at NoFilterDC. Happy Friday.